of the audience. I'm pleased that you could attend this presentation and listen to my opinions on the most effective approach to caring for patients with schizophrenia disorder. Allow me to start by offering a comprehensive outline of our subject matters. Schizophrenia is characterized by incapacitating episodes of personality traits that may hinder everyday functioning. The capacity to have conversations with non-existent people and the sense of voices that aren't physically there are among these traits. Mood swings include anxious thoughts followed by emotional outbursts like laughing or crying. Disruptions may take many forms, including a ostentatious attitude, dishonesty, chronic depression, agitation, and a string of repeated crises. Determining whether a patient has hereditary or drug-induced schizophrenia is also important for effective management and treatment of the disorder. Antipsychotic medicine and psychosocial intervention in therapeutic settings, including group therapy and individual counseling, are successful ways to control or cure the episodic issues associated with schizophrenia disorder. Finally, medication treatments for schizophrenia must include antipsychotics with mechanism of actions, MOAS, to effectively treat and manage symptoms. These medications stabilize and manage the patient's condition by regulating the amount of dopamine that may reach the targeted area of the brain via the synaptic portal. Now let's talk about possible causes of schizophrenia. And contrary to common opinion, there is no conclusive evidence about the particular genetic or environmental components that create schizophrenia. This is important to know before delving into the potential causes of the condition. When it comes to medicines or self-induced schizophrenia, however, there are ways for physicians to detect it. In addition, researchers can analyze the length of time between the onset of symptoms and the end of treatment to determine the subtype of schizophrenia a patient has. Other factors, such as the patient's reaction to medications and an overall assessment of treatment efficacy, are also considered. Sources reveal that the etiology and pathophysiological mechanism of schizophrenia are not fully understood. But however, despite former and present debates on the causes of schizophrenia disorders, research articles say that, in short, the over-replenishment of dopamine, among other key neurotransmitters, is a key cause of schizophrenia. The development of antipsychotic medications in the 1950s shook up the field of schizophrenia treatment. At last, some drugs might alleviate many different symptoms of the disease. Another important factor in lowering the likelihood of recurrence is maintaining the antipsychotic drug following successful acute therapy. Immediate effectiveness of antipsychotic is minimal but on an average. By random research and by conventional standards, it was discovered that the effect size for overall symptom reduction outside what was seen with placebo in a recent systematic review of individuals with persistent schizophrenia was modest. However, the medical consequences were substantial because professionals observed each and every benefit, particularly the placebo effect. In addition, a positive NNT of 5 was achieved by 51% of individuals who received psychotropic medications, as opposed to 30% administered with placebo. Even when the response criterion was set as minimal improvement of a drop from baseline to endpoint, a smaller percentage of subjects had a satisfactory performance in a recent study. There was a lower PANSS BPRS decrease from beginning to end, namely 23% compared to 14% with the placebo. NNT equals 8/9. Though randomized controlled trials have not examined the success rate of changing antipsychotic treatments enough, doing so might increase overall outcomes and practical application by improving tolerance and efficacy. Participants on their first episode had a much greater response rate. Clinicians need to determine the most effective psychoactive and medicine available for the treatment and management of positive, negative, and cognitive psychotic symptoms, all underlying the conditions of schizophrenia disorders, because within those three symptoms lies the very essence of which area of the brain to target. Treating schizophrenia. You see the little lady saying, "Praise the Lord." Finally, after so many years, there are proven ways to help minimize positive symptoms of schizophrenia. For example, as we can see in the image above, there are two great ways to either stop or manage schizophrenia. They are antipsychotic medications and psychosocial therapy or intervention. Antipsychotic medications. In recent and temporary history, the first generational antipsychotics were used to treat symptoms of schizophrenia that were often portrayed in the onset of psychotic episodes. The antipsychotic were used to block dopamine, and as a result of doing so, it only blocked dopamine, thus leaving much room for improvement. To improve the management of schizophrenia disorders, to rectify this issue, clinicians began to use antipsychotics to measurably block both dopamine and serotonin. Let's talk about psychosocial therapy. Psychosocial therapy intervention, individuals dealing with the psychological therapies such as various forms of counseling as well as social and job training, in addition to enhance the standards of living. They have the potential to reduce illness and escape and ease problems in daily living, including at home, in the classroom, and on the job. Research shows that psychological interventions have the potential to improve outcomes for people with psychotic experiences. Time for review. The role of neurotransmitters in the onset of schizophrenia disorder. Research shows that schizophrenia psychotic symptoms are primarily due to subcortical dopamine deficiency, with amphetamines increasing dopamine levels, leading to delusions and psychosis in patients with schizophrenia. 2. The role of receptors in the pathological onset of schizophrenia. Scholarly source found that P2X7R controls physiological neuronal branching throughout early development, and brain growth lower its expression, and that endogenous receptors, which is called P2X7R activation, is sufficient for cognitive and positive symptoms at higher ATP concentration, suggesting that its role in neurodevelopment issues, better known as schizophrenia disorder. Thirdly, the route of administration of antipsychotic drugs. Dopamine pathway blockers can be administered by mouth, with the first generation antipsychotics like thiodiazine, pamazole, and meladone. Also available intravenously, second generation medication like olanzapine and aripiprazole and risperidone, and administered both intravenous and oral. Half-life of antipsychotic drugs for the relief of schizophrenia. Studied by Mr. Jerry Hellar's half-life study reveals that 90% of a drug is excreted after a 3.3 half-lives, and 94% to 97% after 4 or 5 half-lives. However, medicines may build up during infusion. A stable concentration of medication in the blood is maintained when drug clearance and infusions rate are balanced with factors like clearance, dosage, and delivery interval affecting steady state concentration. Number 5, the importance of the right amount of dosage of antipsychotic drugs. Antipsychotic drugs have unique dose-effect relationship impacting effectiveness and side effects. Tailoring doses to patients' needs is crucial. Factors like adaptive phenomena and complex interdependencies affect the correct dose. Medical practitioners should observe abnormal plasma levels when treating patients. Oh, but wait, there's more. Talk a little bit about the side effects, drug interactions. Side effects of antipsychotics, typical negative consequence regarding schizophrenia medications, encompass functional deficit or decline in overall quality of life, mortality, complications, prejudice, and ineffectual management which resurface schizophrenia are further exacerbated by their presence. When determining choices about therapy, it is recommended that medicinal professionals and clients engage in a discussion regarding the potential for negative consequences. Regrettably, an exhaustive compilation of the adverse effects associated with antidepressants and psychotropic medications that could aid in the investigation is not yet available. Further, it is a tricky and multifaceted undertaking to consider every conceivable negative outcome. Drug interactions. Psychotropic substances should be the sole treatment for schizophrenia, but multiple antipsychotics may be used in healthcare settings. Pairing depends on age, region, treatment resistance, hospitalization status, and illness intensity. Contraindications. First generational antipsychotic contraindications are known to cause unpleasant side effects after use. So much so, it was necessary for scientists to find medications to help patients cope with the illness of schizophrenia disorder without dangerous side effects. The first generation antipsychotics was known to cause prolonged and or permanent damages. Just as first generations, however, antipsychotics, second generations antipsychotics comes with side effects only. The FDA provides warning label to caution consumers about possible danger if consumed. That is if you are pregnant or have an underlying condition such as dementia. And to take another recap on being cautious, risk and benefits. As you see the lady who making decisions in her mind, she decided, yes, I think it's good to take on antipsychotics. But the other guy who may have taken on risk that wasn't quite so well for him for whatever purpose or another. Taking drugs of any sort can lead to death or permanent injury. So when it comes to taking antipsychotics, there are always risks. Maybe in faulty prescriptions due to erroneous and hasty diagnosis, or maybe the patient is filled with anecdotal beliefs. For example, like, you know how they say, my grandma says that taking crazy pills make you crazier. The point is, the risk of taking drugs of any sort depends upon the situation. For example, a stubborn patient who believes the doctors are just out to get them. However, the symptoms of schizophrenia are getting worse. In this scenario, the risk of not taking prescriptions can mean hospitalization, as we stated earlier, or death. Researchers suggest that the non-compliance of patients with their prescribed antipsychotic medications regimens could potentially result in adverse clinical outcomes. Thank you. Thank you very much. Goodbye. And thank you for attending. My name is Emmanuel Berry. Thank you for having me.